The time is now 9 o'clock, and we will go ahead and get started, everybody. So people are still joining. Thank you to everybody for joining us on this lovely Friday morning. My name is Gavi Berman. I am the Director of Community Outreach and Business Development for Central Florida Behavioral Hospital. I am going to be your host as we host this excellent and timely workshop on the topic of complicated COVID anxiety syndrome, a workshop for mental health professionals. And after this workshop, as Dwight has shared with us, that he is going to be providing some excellent resources and tools for everybody to be able to use and to take back and to equip themselves to treat their patients and themselves in our communities here. So for those of you who may not be familiar with our hospital, and every time that we do one of these webinar trainings, we have new people each time. It's amazing to me how many people are finding value from joining us. It's just proves to me that the value that we're providing by doing this. So every time, to me, it's important to make sure that people are aware of who we are and the resources that are available to them in the communities. So for those of you who may not know, Central Florida Behavioral Hospital is a centrally located freestanding psychiatric hospital. We have 174 beds. We're across the street from SeaWorld. We are a Baker Act receiving facility, and we provide behavioral health, mental health, and substance abuse and co-occurring disorders treatment for people of all ages. What makes us a little bit unique is we do have 8 units that are separated by age and diagnosis. We're very fortunate the way that our building was constructed to be able to do that. Each of our units are designed in such a way that the milieu is geared to treat, as well as the treatment planning is geared to treat the demographic that's treated on the unit. So we do have, for example, a mature adult unit that's typically folks that are 55 to 60 years and over. That is for people that may need a little bit more help in terms of their ADLs, their daily living skills. There are our nurses are a little bit more trained to help folks that need a little bit more assistance with their daily living skills. We have a dual diagnosis unit, which is for obviously folks that are primary mental health and also are dealing with substance abuse issues. And we also have children and adolescents. We have 63 beds for kids. We're probably one of the largest providers in the area for kids. We really took that upon ourselves as the pandemic has grown. We've really seen a tremendous increase in need for child and adolescent services. And so in addition to the inpatient side, what we did is we also, because of the need, we created an adolescent virtual IOP program. And our goal is to ensure that as many children as possible that come to us in adolescence are able to have a pathway to step down into our IOP so that when they leave us, they're continuously engaged with their mental health and the recovery. And the goal, of course, is for them not to come back. So we have really gone big into the child and adolescent scene in order to really meet that need that really is a need in the community. We've stepped in to meet that need. In addition, we also have a high acuity unit. This year, we are certainly going to be opening up, I'm hoping very shortly in the near future, our facility for tours to be in person again. We're excited to see COVID go away. We're hoping, our fingers are all crossed, as I'm sure yours are as well. And we would love to, when that does happen, we would love to invite everybody on this call at some point to come in and see our facility. We also do have an ECT suite, electronic convulsive therapy. That is part of the hospital, but it's sort of a standalone building. That's a little bit unique to Central Florida Behavioral Hospital. We are hiring. We are hiring for all positions. We're hiring excellent people. We are looking for people that are interested in providing excellent care, that care about their patients, that care about service to others, and that really care about making an impact in their community. We provide excellent compensation, sign-on bonuses, shift differentials. There's absolutely unlimited career growth. And the best part about working here is that the patients and you as a potential employee come first. So if anybody here is interested in working, we are absolutely interested in hearing from you. Please reach out to me directly, and I'd be happy to share your information with our HR services team. Also, you can go onto our website, of course, and to our LinkedIn, and you can search what jobs, and Indeed, and you can search what jobs are available and apply. Send me a link, and I can, of course, work to expedite that internally. Okay, so we'll go ahead and get ready to jump in here. Just a couple of housekeeping items. Today's webinar workshop is 1 hour long. That will include Q&A. Dwight at the end will open the presentation for questions whenever he is ready. There are quite a few people on the call here, so I will ask that everybody please puts their questions or comments into the chat box or the Q&A box. Rather, I won't be able to open the phone lines just because there's too many people. So please make sure to put whatever questions you have or comments. I will curate questions for Dwight towards the end, and we will make sure to answer you. For the webinar is being recorded. So if somebody you know would be interested in watching this webinar, or if you, after watching it, think it's so amazing and would like to be able to watch it again in the future or share it with somebody else, it will be posted on our website sometime next week. It's typically about 3 or 4 days before it gets posted. So you can certainly go there. That's where it's located here in the resources section of our website. There's a whole bunch of resources there as well from all of our past webinars you can find there as well as a whole bunch of other resources for schools and individuals that are dealing with adolescents this year, and a lot of other resources to other organizations. Eligible to attend, when the presentation ends and or Zoom exits, you're going to be prompted to fill out the seminar evaluation. That's going to bring you automatically to a Google form. So when that happens, don't be alarmed. You're not. It's not a pop-up that you should be scared of. That's actually something you should complete, so that we can go ahead and make sure to give you credit. I do want to mention that a lot of times when we do these CEUs, I get a lot of requests about whether or not the credit has been posted in CE Broker, and if not, when. And I just want to let you know that we do a lot of trainings, and we have one person in-house that is really posting these on CE Broker. So just have a little patience with us, but everything will be posted. I'd like to give us 60 days to ensure that happens. So if it doesn't happen within 60 days, then please send me an email, and I will absolutely look into it. Certificate of completion, I will email those out following, as well as the resources that Dwight will be providing from his training. So I will send those out immediately following in a follow-up email that will also include a link to the webinar, to the evaluation, just in case you missed that as well. And with that, I'm going to go ahead and introduce Dwight. And Dwight, while we're talking here for a second, I am going to also make you a co-host. So that way you are able to grab my screen. So for those of you that do not know, Dwight Bain is the founder and president of the LifeWorks Group and is nationally certified counselor in practice since 1984. His primary focus is on solving crisis events with creative solutions. Dwight Bain is a trusted media resource who has been interviewed on over 500 radio and television stations, as well as quoted in over 100 newspapers, websites, including New York Times, Washington Post, Chicago Tribune, Atlanta Journal, Orlando Sentinel, Miami Herald, Newsday, FoxBusiness.com, and MSNBC. And I'm sure there's plenty more. Dwight, with that, I'm going to hand this over to you. I've made you a co-host. You should be able to grab the screen.
Let's see what that one looks like.
All right, I see your screen.
Do you, just as a tech point, Gabby, do you see presenter view, or do you see full page?
Yeah, I see your presenter view.
How about now?
Perfect. Rock and roll.
And so we're talking about complicated COVID anxiety syndrome. I love what was said earlier. Wouldn't it be great if we could be back in a building? I would ask you, if we were inside Central Florida Behavioral Hospital, I would say, have you felt more anxious these days? Raise your hands. And we would look around, and you would see about a third of people would raise their hands. And it's not because everybody in the building didn't feel anxiety. It's because they're too tired. They're too depleted. A couple of months ago, when we talked about our training time today, complicated COVID anxiety. When you start to look into the medical, the psychiatric news, you see post-pandemic anxiety. As things are changing, humans will adapt relatively quickly, about 3 out of 4. And right now, COVID normal means that people are used to wearing masks. They're used to social distancing. They're used to things, but there's about a fourth of the population that are struggling with the anxiety. Pandemic stress, what are the long-term effects we're seeing in the literature? And then right now, is there a perfect storm happening? You're seeing that all over the news. And what's happening with not just one variant, there will be many more. How are we going to survive when 2021, there have been more deaths from drug overdose than any year in recorded history? 1 in 500 people have died from the pandemic. I heard the news the other day. A friend of mine from a radio station I used to work at, John Adams, his wife Jackie, both died within 5 days of each other from COVID-19. These are challenging times. Many people are feeling overwhelmed and frustrated because, wait a minute, I thought this was supposed to be done a year ago, January 2020, right? The global pandemic will be over, and 2021, a new year, opportunity. And now as we finish up 2022, when does this end? I asked Siri, how long has it been in days and weeks and months since the announcement on March 13, 2020? 2 weeks, shut everything down, stop the spread. How long has it been? 637 days, 91 weeks, 21 months exactly today. That's a photo of our local Publix on March 13. Before I left for the day, it was a Friday. And I called Sheila and said, do we need anything from Publix? I'm going to stop in. She said, yeah, apparently we need toilet paper. I said, really? She said, yeah, there's this thing on the news that says we need toilet paper. And that's what Publix looked like at 5:30 p.m. on a Friday. That's toilet paper, paper towels, not one to be found. You see, we're 21 months. Some people call it COVID brain, exhaustion, depletion, overwhelmed, bone tired. Maybe your family's in crisis, your friends are in crisis. Maybe it feels like your community is in crisis. And if you're watching the national news, doesn't it feel like our country is in crisis? Now listen, this has been the longest mental health challenge of modern times. 49, this is as of yesterday, 49.6 million infected in the United States, 793,000 killed. That's yesterday. It'll keep growing. When does this end? I don't know. But I know how to get you through today. Complicated COVID anxiety is real. I mean, look what the CDC data gives us. 41% of individuals in the last 21 months have faced a mental health challenge specifically related to COVID-19. Now, you're a mental health professional, right? So take a breath. No, really. Let's do it slower. Big breath. Out real slow. I know you're tired. I know you're tired. There are some places that tell me that since the global pandemic started, they've been at 100% capacity, no hours, waiting lists that go into the months long. I talked to a dad this week. He said, I've been trying to get a visit for my daughter. She's a UCF student. And he said, we can't find anybody within even a few weeks, much less within a few days. 41% of the population say, I'm feeling it. 31% said I've had anxiety or depression. 1/3, 13% said, I'm just going to find something to drink away the pain. You know what? I'm going to get some fentanyl and I'll just turn off my brain. 26% said I've had trauma. We'll talk more about that at a different time, but look at this. This is as of Monday of this week, 11% of research from the Centers for Disease Control, 11% of the population said they had seriously considered suicide in the last 30 days. Suicide numbers greater than any time in my career, 30 years working in mental health. Thanksgiving night, a wonderful friend of mine said, do you remember my son? I went, yeah, absolutely. I met him at a wedding years ago. He said, yeah, he killed himself with suicide. after Thanksgiving dinner. He was 35. Look at this, 22% of essential workers, that's me and you, and 31% of unpaid caregivers reported seriously considering suicide in the last 30 days. Stop, take a breath. I know you're tired, but I want you to know you matter, because 1 in 5 of our colleagues and our peers, talking to some firefighters this week, and one of them said, yeah, a guy I'd worked with, he was always seemed upbeat, cheerful, killed himself with suicide. That's why I'm so thankful Central Florida Behavioral, one of the few places in our state that has a special backstage VIP entrance to care for first responders and essential workers. But 1 in 5 say, I can't go on. 1 in 3 unpaid caregivers say, I can't go on. That's not a sign of weakness. It's a sign of being human. The Journal of the American Medical Association, the psychiatric division, so the combination of physical distancing, economic stress, pervasive national anxiety, a spike in gun sales, it creates a perfect storm for a suicide mortality. There's going to be more. And part of this is because of something called COVID anxiety syndrome, or CAS. That's our big focus today. It's complicated. So let's look at some of the symptoms. And I want you to think about your patients, your clients, maybe even think about your own family. And absolutely think about you. I spent dozens of hours preparing, my research assistant, Aniston, helping me, the latest data, the most current tools and techniques to help you, because your work matters. But I knew in a group this size that if we just use that data, 1 in 5, you don't know how you're going to go on. And if you're like so many people in our own family, caring for other family, you're tired. So let's look at the symptoms, you and I. Compulsively checking for symptoms of COVID, a cough, a sneeze. And if you work around education, my wife is a teacher, you know that if a child has a cough or a sneeze, everyone at school gets scared, even though if they say, well, it's just a cold, it's not COVID. Avoidance of public places or crowds. And there's still some people that have not left their homes, or have not left other than to go to a doctor's visit in 21 months. Obsessive cleaning, trouble sleeping, self-isolation when you don't have to self-isolate. Feeling hopeless or feeling bitter and resentful. I don't want those bitter people on Facebook when their prefrontal cortex is not functioning. There's some people saying hate-filled rants, ruining relationships. And part of it's because they're so overwhelmed. Doesn't make it right. Don't go on social media. You know, the old saying, if you had too much to drink, don't sit down and text your ex. Not a good plan. If you're mad about everything, do not go on social media. It will not make you less angry, but it might make you say something impulsive that hurts somebody else. Anxiety leads to multiple psychosomatic illness, psychosomatic related aches and pains. And this is not a sign of weakness. Remember, psychosomatic is real. The pain is real. It's just hard to get a medical diagnosis because it's coming from a psychological source. We could do a whole training on that, ignoring your friends, your family, your partner when they say, I think you're too worried about this, and telling them, hey, listen, I have to go do some doom scrolling, as it's called. Elevating or imagining the risks. Everything's life or death. Everything's life or death. Everything's life or death, except not everything is life or death. Right, here's what magnifies complicated COVID anxiety. Someone who has a low threshold for uncertainty. In other words, they really have a need for control. They're exhausted. Aren't we all? Continual media coverage. The solution for that? Turn off the continual media coverage. Doom scrolling means Twitter, Instagram, Facebook, following a hashtag of something. Oh yeah, I knew it. I knew this was going to happen. Listen, you put out a fire with water, not gasoline. And there are some things that absolutely will create more anxiety. And typically media, social media, it can make it worse. The perception the government is using fear. Oh, they're forcing vaccines. They're forcing face masks. They're doing this on purpose. Big brother, take a breath. These are things that magnify and elevate, and it can lead to bias and bias blind. So what do you do in this complicated situation? 637 days. Remember the words of Greg McEwen, overwhelmed isn't having too much to do. Overwhelmed is not knowing where to start. So let me ask you a question, right? Psychology 101. I taught that class once forever ago, and I would teach the students, what do you see? What do you see? Do you see a vase? Do you see a face? Now, if we were together, I would say, raise your hands if you see a vase. Raise your hands if you see a face. Rubens' vase. Edgar Rubin was a psychologist, and he noticed this in 1915, over 100 years ago. Because I want you to understand, some things are not a black and white issue. Well, it's just, stop watching the news and your anxiety will go away. No, these are mental health issues that are much more complicated. Is it black or white? Or is it gray? Or listen, is it both? I want you to understand. I want you to see the whole picture. I want you to be able to see both. Because right now, I want you to understand, complicated COVID anxiety, there is emotional distress. People are anxious, irritable, depressed, grieving, angry, moody. In live audience, the next time we have a chance to do that, Gavi, I'll say, turn to somebody next to you and say, don't be so moody. And we'll all laugh because that's just a normal sign of feeling overwhelmed. Post-traumatic stress, notice there's no D. Secondary traumatic stress. We'll talk more about that in a moment because it's complicated. And then it gets worse. Panic attacks, overwhelming feelings. Haven't we seen this in the last few months? Infantile emotions in adults. The prefrontal cortex, where they have executive function, the ability to think clearly, is just gone. It's overwhelmed. Immobilizing depression, or somebody who's just numb. Complex post-traumatic stress disorder. Cases are rising. One of the precursors for suicide. We touched on, it's been the worst year in recorded history in the United States of death related to substances. I'm so thankful when somebody calls in a crisis with drug, alcohol, when they say this is happening, this person's threatening to kill themselves. Happened the other night. Kelly Matthews, many of you know Kelly, she shared that in the middle of the night, some adolescents who were going to die, their lives were stabilized and saved because Central Florida Behavioral is 24 hours a day. I'm so thankful when Kelly shared that. Because right now, the behavioral dysfunction, people are violent. There's antisocial acts. I had to explain to somebody this week, big guy who said, my wife hits me, kicks me, spits on me. And I said, listen, he was embarrassed. I said, listen, abuse is wrong no matter who does it. This is part of somebody who feels overwhelmed. Some people, it's a percentage, it's a small percentage, will go to violence. Some people don't have the energy to take a shower. They can't sleep. They self-medicate. But it gets more intense. For some people, they feel crushing guilt or survivor guilt. How come I'm still alive and my grandma died? I don't understand. Look at one of the indicators, time distortion. Isn't it odd some days? What day is it? What month is it? What year is it? People have made the metaphor about Groundhog's Day, but if you go into some of the blogs about that film with Bill Murray, it's a classic romantic comedy. But if you go into some of the blogs of people saying, how long would it take for him to learn how to get out of the time warp? And in Buddhist teaching, to get to that level of mastery would take about 40 years. What day is it? I don't know, but if you remember the Bill Murray film, you know he wanted to give up on living more than once because you can't concentrate, you can't make decisions. decision fatigue is a real thing, being preoccupied with everything that happens and obsessing about everything that happens and being unable to have work-life balance because you can't even understand the consequences of your own behavior. More affairs than I can remember of people having affairs with coworkers. And you say, what's happening? Are they giving up on their marriage? Sometimes they're just impulsive. They're not thinking because their core beliefs have been shattered by trauma. I thought the world was supposed to be fair and just in the legal system. I thought the world would be safe for my kids or my grandkids. I thought the government could be trusted. The leaders would be stand-up people that I could count on. Everything feels shattered right now. There is the thought, maybe you feel like that dog. If you're exhausted all the time, it's what one psychologist calls languishing. I just don't have any energy. As Gabi said, what about students? What about young people? Because for some, they've lost 2 years academically. Some have lost friends they'll never see again. Some will not look back on high school as the happy days that Richie Cunningham and the Foz, if you know that, Fonzie, if you know that television show. It was a happy time. High school was a happy time. Students right now, they feel like they lost their childhood. It's not just the students. Gallup in a research study said teachers in some districts, as many as half of teachers are saying, I can't go on. I'll go work at Target. I can't function. I can't do this anymore. It's overwhelming. K through 12 enrollment has gone down as more and more parents say, I can't take the risk of my kid being bullied at school or harassed or getting sick or bring it home to grandma. We'll just do virtual school. Education is challenged right now because what we found in our research was that parents and managers, young employees, young people, had the lowest mental health scores. Are you a parent? Do you work with parents? Are you a manager trying to hire people? Are you a new employee in the workplace? Are you a young person working your first job? They're having the hardest time. It's difficult, but we know working in clinical psychology and psychiatry, if you've worked around behavioral hospitals, 75% of mental health conditions develop by your 24th birthday. This is why it's important to open conversations. Mr. Rogers, who went to Rollins College, maybe you were there when Fred Rogers' son unveiled the statue at Rollins dedicated to his father. Mr. Rogers said, anything that's human is mentionable, and anything that's mentionable can be more manageable. When we talk about our feelings, they become less overwhelming, less upsetting, less scary. So what do we do with kids that are scared or parents who don't know what to do? Maybe they're the parent of an infant. And the ebook that Gabi's going to send you as a gift from Central Florida Behavioral, the COVID Psychological Recovery Kit, is over 160 pages of tools and techniques. And it covers in great detail every age, every grade. Let me just give you a quick overview. Infants and toddlers who regress, they were toilet trained, body trained. They can't do it. They cling. Don't leave me at the daycare. I can't function because they're overwhelmed. 3 to 5 years old. They go back to the security blanket. They go back to sucking their thumb. It's age inappropriate for someone who's about to go into kindergarten, but they're wetting the bed. They can't function. They're terrified that they'll lose their parents. We saw, I think it was months ago when we did a training specifically about children here at Central Florida Behavioral. But when you look for comparisons, you look for a population of young people after a time of war. We have a lot of data about what happens to kids when it's been years of prolonged tension, conflict, crisis. And there's 2 groups, a very resilient group. We'll talk about resilience in a moment. And there's a traumatized group that sometimes never seem to come out of it. You can spot that as young as 2, 3 years old. By the time they get into 1st, 2nd, 3rd grade, you'll see a lot of sadness, feelings and fears of being abandoned, being afraid of losing both parents, because 793 people have died from this. It hasn't gone away. breaking down, crying, sobbing, what some people call meltdowns. Or for other kids, the ones that are more anxious, they hear somebody else cough or they cough and they think they're dying. By the way, see www.coronavirus.gov. Coronavirus.gov will give you a full detailed list so that you can sit down with a child and help them past their fears. Other things that happen in this age group, because about third grade, children can first understand the concept of what dying really means, or the world ending, or their parents dying. And sometimes they'll revert to shoplifting or stealing. Sometimes even as young as third grade, cutting, or feeling ashamed because they realize they're different. Our family says you can't do anything without a face mask. You can't come to our Christmas if you're not vaccinated. And somebody else's family says vaccines are silly. It doesn't do anything. And the kids start to feel the pressure of the parents. They start to carry their parents' pain. Early adolescence, they can feel isolated and lonely. And remember, so many mental health challenges happen in adolescence. They lose their peer group. And for many young adolescents, that's their number one support system. Or for some, it's an absolute loss of identity. I thought I was going to be a cheerleader and our school doesn't have sports anymore. Like what this teenager said. She said, it wasn't our choice to be born into a doomed world, all this terrible stuff. It's so frightening. Well, Cindy, I agree with you. It is. Older adolescents worry about their financial future, finding a job, not finding a job, helping their parents with money because they see how much their mom is struggling. For some, it's chronic fatigue. They can't concentrate and they still have to take an SAT. Or maybe they feel deep loss because when's normal ever going to come back? Maybe right now you're saying somebody should do something, and I agree with you. In fact, the Jewish prophet Isaiah said, I heard the voice of the Lord saying, whom shall I send? And who will go for us? And then I said, here am I, send me. You see, I know that you care about people. That's why you blocked out time this morning. I thought, how can I help you identify acute secondary traumatic stress? How can I help you spot the warning signs? Because after 21 months of COVID, people are making impulsive decisions. Now watch the level. Stress response is everybody. This has been a global pandemic. Cumulative stress is everybody. Stress on top of stress, on top of stress, on top of stress, on top of stress has led to exhaustion, depletion, burnout. This is diagnosable. ASD, acute stress disorder, is a precursor to PTSD and self-destructive behavior. ASD, and you may have not used that diagnosis in a while from the DSM. It's a normal reaction to continual stress. PTSD is a life-threatening reaction to continual trauma. So how did the DSM break it down? Intrusive symptoms, negative mood symptoms. Look at dissociative, time slowing, being in a daze. Don't you see people like that now after coming up on 2 years? In fact, it was about 20 months ago that Vicki Lewis from Central Florida Behavioral said, we have to give tools and techniques. We've never seen anything like this. We have to give tools and techniques to our community partners. And I'm thankful to be part of the team to be able to do that, because acute stress is real. For some people, it's avoiding memories, thoughts, feelings, arousal symptoms. And we'll be talking more about this in the future as the pandemic medical symptoms, the physical symptoms go down. And right now they're saying maybe 2 months. The psychological systems we're going to see will ramp up. So how do you manage post-pandemic stress, or what some people call FONO, the fear of normal? There's a tool that I wanted you to have. It's not in the ebook that we're going to send, but it's a screening tool. And maybe you've already been using it. It's called the COVID Anxiety Scale. And there's a link. You'll see it right at the top of the page. and take a picture of that or just dial it in on a separate browser. Because you can download this. It's a free resource, and it's to measure 5 variables across 4 levels, really 5. So that way you're able to get a numerical score, and you're able to help the clients that you serve. Do they have complicated COVID anxiety, or do they have more standard anxiety? COVID anxiety, slightly different. You'll see there's 5 questions. And then as you go through the questions, you're able to score that. And you'll see the scoring and the interpretation. The psychometric properties, and there's the scale. You see it at the bottom. And you're able to use the COVID anxiety scale. It's in the public domain. It's a new tool. You don't have to have any permission. But I want you to be able to start to use the COVID-19 anxiety scale, COVID anxiety scale, so that you can measure with your clients and your patients. Because COVID will end. It will. Take a breath. And resilient people go on a breath at a time, because sometimes a day at a time is too hard. You've heard people say that if you've ever been in a 12-step group. I've been in one for a long time. Hi, I'm Dwight. I'm a sinner. But sometimes one day at a time, that's too hard. People will say, well, if a day at a time is too hard, what do? You take a step at a time. What if that's too hard? Like my friend whose son killed himself with suicide. Well, then you take a breath. Haven't we been doing that? You take a breath, and sometimes even that's hard. So is it possible to calm your mind, to be able to find some degree of serenity during a pandemic? Yes, it is. Just calm your mind for a minute. It's absolutely possible. And for some people, they'll say, well, my mind is calm because I know that in Florida, 72% of the adult population have been vaccinated. I'm not going to be worried. And you'll see, not quite that, fully vaccinated. So it's not the worst place in the United States, right? We're at 70%. And for some people, that'll take away the anxiety, but not complicated COVID anxiety, no. In your digital book, the follow-up that you'll receive is a tool to help you. And it really is a holiday gift. I worked on it month after month after month. Just finished it last week. And I want you to have it as a gift, because there's a scale that'll measure your own self-care, family care, friend care, coworker care, client care. And it's just a series of dashboards to keep you healthy. Because everybody's going through this global pandemic. We're all going through it at the same time. We're facing the same risks of the pandemic, but not everybody's managing it the same way. COVID will end. And you'll come out of this time stronger, resilient, mentally tough. You'll come out overwhelmed if you come out at all. You see, mental resilience boosts your immune system against disease. It gives you mental toughness to face whatever is coming next. And there are 5 essential factors you and I need to develop resilience: mental, physical, behavioral, social, spiritual. When those line up, you have achieved the habit of resiliency, and your energy level will stay strong at the end of the day. I have one of those smart watches that talks to my phone, and it tells me how well my sleep did. That's been super helpful. I'm thankful that my sleep's better than it's been in my entire lifetime. It measures energy, and I'm thankful most days at the end of the day, I'm usually around 80% battery, body battery as it's called, body energy on the smartwatch that I use. It's it's called an Instinct by Garmin. And my wife and I kayak, and we kayak with some friends. So I didn't know it had those features until the pandemic. but it's been pretty helpful to see that on most days. There have been some days it was down in the 30s, and those were usually the days that a friend or family member said, you know, they're dead, right? From COVID or suicide. A couple from overdose these last 21 months. And those days, I sit on the floor and I cry. And I grieve a little bit. And I call the psychologist that I've gone to for years. And I'll say, can you work me in this week? Because it's really hard. Because there are 5 zones, and you have to have all 5 to keep that energy level. The mindset zone is to face emotions directly, process those emotions, to be able to do things, to laugh again. Did you know that you and I are allowed to laugh again? Can you laugh during a time of global crisis? Can you have a birthday party for a kid? 100%. You can learn to say no to bad habits. I hope that today, mentally, financially, relationally, I hope that your relationships are better than they were 21 months ago, that your money's better than 21 months ago, your career is better than 21 months ago. There's a brand new series I'm so excited about with a training group that I teach for out in Texas. Career repurposing. In fact, Gavin, that may be something that we look at because so many people are repurposing their jobs, moving from a day job to their dream job. Is your career better than it was 21 months ago? I hope so. Are you journaling most days? I hope so. And one of the things I want you journaling is like Willie Nelson, the great philosopher. Yep. Willie said, when I started counting my blessings, my whole life turned around. I hope you could say that. I hope you could say, you know, I'm counting blessings, not counting problems. But it doesn't stop there. You have to get some exercise. Maybe you'll be out tomorrow. If you are, I hope so, at SeaWorld. Greg Warmoth's Reindeer Run. I saw my friend Greg yesterday at the Track Shack. Now I'm going to walk it. I don't run, but I walk a lot, 15 to 20 miles a week. And I've done that throughout COVID because I can tell you it's not fancy, but just walking a lot, clear your mind. You have to get deep sleep. I had really good sleep last night, but I have to say, I woke up on the very first alarm excited because I knew we were going to spend our time together. And I thought they're going to be at least a couple of people are going to walk away with some tools where they're going to be inspired to start some sleep rituals and to be able to get hydration that'll boost your electrolytes. It's not just saying, well, I'm going to drink more water. Do a little research about electrolytes. I don't mean sugary kind of things like you can get at a fast food restaurant. Oh, look, it's a sports drink. Sometimes those have as much sugar as soda. Pay attention to your health. It's part of mental and physical resilience. Deep breathing. Didn't we do that today? Being able to take an energizing nap. Obviously, medication, if your physician prescribes it, not a problem. But there's a behavioral piece. You have to have a daily planning time. Utilizing planners, mapping things out, having priorities in your life, single focus to get things done. Right now, we know that the average adult will pick up their smart device 74 times a day. Adult, I didn't say teenager. Well, that's called time confetti. You're just shredding any available time. Put your smart devices into airplane mode to get something done. To get something done is where you'll feel productive. There are 60 different coping skills across 5 zones. And if you'll read, reading is one of them. Oh, yeah. And today I'm gifting you a brand new ebook to help you get started. And I can't wait to read your insights of the ebook that you write or release on Amazon.com. The next zone is meaning. A month before a global pandemic, Kobe Bryant was killed in a helicopter crash. And if Kobe could come back, he would say, what matters most? Spend your time on that. You see, meaning comes from relationships, talking about things. If you talk through it, you get through it. Connecting with family, not being afraid to confront things. Healthy people can have hard conversations. Learning to say no to manipulative behavior. It's what Viktor Frankl found in a Nazi death camp. The more one forgets himself by giving himself to a cause to serve or another person to love, the more human He is. That's how he survived a death camp. He took care of other people. You see, it's the spiritual part. You're not on this planet by yourself. Sometimes the greatest joy can be adding value to other people. And the spiritual part is inspirational music, volunteering, helping other people, taking time to pray every single day, forgiving people, forgiving yourself, building spiritual strength through meaningful experiences. My wife and I tonight are going to an event to sing some Christmas carols, some traditional ones. Guy from a church that we know, and I don't know him, but she said, let's go to this. And I went, I can't wait to sing in a crowd of strangers some traditional songs because I know it'll inspire. I know it'll inspire. Attending events for community connection. You say, well, I've got anxiety. I don't want to be in a crowd. You can be in a crowd safely. CDC.gov, johnhopkins.edu, World Health Organization. There are ways to safely do things. One of the ways to shatter COVID anxiety is to take a little step to be able to do what I call reverse Jenga. If you know Jenga, the children's game, you pull the blocks out until it falls down. No, you and I practice reverse Jenga because healthy people, mentally healthy people know they have mental health needs and they take action to do something about it. It's to be able to face it. It's to be able to feel it and grieve. There's a lot of grief. But when we do that, we grow resilient, putting the blocks back in so that we get stronger on the other side of this crisis. Because in 1918, two groups came out of a global pandemic. The last time this happened was 100 years ago, two groups. One group, kind of like on the Oregon Trail, they were resilient. They took the next step forward. I read a book, because I read about a book a week. I just love to read. And I read a book about it, and it was amazing. They just kept taking a step forward. About every 1,000 feet on the Oregon Trail is a tombstone. People died, and you had to keep going. But I said there's two groups. Yep. One group I'm going to call a resilient traveler. The other group we'll call a traumatized tourist. What's going to happen next? And they doom scroll. That just means they're on social media looking for bad news. It's out there, but they don't keep moving forward. You work in the field of mental health. You partner with Central Florida Behavioral, one of the leading behavioral hospitals in this region. And mental health is a priority. And the rest of our lives, we're going to hear about mental health because of Michael Phelps and Meghan Markle and Demi Lovato, or the most followed woman on Instagram, Selena Gomez, you may have seen. She launched a platform, a mental health platform. It's called Wonder Mind. It came out the other day. Celebrities are saying you have to work on your mental health. And when people watch that, some of them are going to say, you know, I do. And then they're going to say, who do I call? And they're going to call you. And you're going to help more people than ever before if you take care of you. Listen, self-care is not selfish. Self-care is strength. To be able to go to SeaWorld tomorrow with my sister and some friends and to walk around SeaWorld and just be healthy and connect. And to feel like, wow, we're doing something to raise money for children who have cancer. It's a good cause, but it'll just feel good to be in community again, to be connected again. You may follow Adam Grant on Twitter. He's a professor at Wharton Business School. I love what he said. Resting is not a waste of time. It's an investment in well-being. Relaxing is not a sign of laziness. It's a source of energy. Breaks are not a distraction. They're a chance to refocus your attention. And play, it's not a frivolous activity. It's a path to connection and creativity. Wow. Thanks, Adam. One of the tools that I've given you is the mental resilience tool. You can scale yourself and score from 100 down to 0. 0 means depleted, exhausted, dying. 50 is average. The average person right now, you'll see it in the downloadable ebook. Stressed, moody, irritated, frustrated, angry, critical, complaining, blaming, irresponsible. And you say that's some of the people that came to my house for Thanksgiving. They're just telling you that they're exhausted. We're also able to say, you know, we're going to count our blessings here. instead of counting our problems. And we're not going to talk about political commentary. We're just going to talk about how thankful we are. Hey, Grandma, tell me a story about how you guys got through tough times after the war, how you got through tough times economically. Tell me how you got through the tough times when that family member died from suicide or a drug overdose or DUI, when your daughter was killed. How did you get through? Because story, changing a narrative, story makes you stronger. And you have a story. I wish we could sit down here in my study in Winter Park and I could say, just tell me a story. Tell me how you've gotten through 21 months. And the more we hear each other's stories and encourage each other and say, you matter, then we're going to see somebody who's not just self-aware and insightful, but they're responsible and disciplined and motivated. Your life is healthier, more balanced, and better than it was 21 months ago. So as we've been going along, I reminded you, anxiety from a pandemic, that's going to end. When? Maybe 2-3 months. What do you see? What do you see in the image? Do you see faces face to face? Because if so, that's you and the people that you help. Do you see a vase? To be able to place some beautiful flowers, to be able to fill with water? What do you see? Or do you see both? Resilient people are able to see, there's a lot more going on than just black or white. Because as you understand and develop what's called EQ, emotional intelligence, as you develop your own sense of awareness, you see the total picture. You see the total picture because you see the total picture in you. It's what I call lining up the Qs. QL, quality of life. You can battle anxiety and the stressful emotions of a pandemic by having a balanced quality of life. That's what the COVID psychological recovery kit is about. You can look it up by chapter. If it's financial, okay, there's a chapter on that. If it's about helping kids, whole section on helping kids by age and grade in school. If it's dealing with difficult family members, if it's saying farewell and grieving, if it's having to put a pet down, it's being able to know, I guess there's maybe not quite 20 chapters of tools, because the more you have quality of life and the more you have EQ, emotional intelligence, and IQ, obviously your intelligence growing because you're reading, studying. That's why I wanted to give you a tool that you could read over the holidays. But don't miss QL. Quality of life cannot happen without SQ, spiritual quotient. Because what you do matters. You're put on this globe for a purpose. You're part of this time right now, this community right now, because what you do matters. I want you to see the total picture. Because when you see the total picture, you'll see that you play an important part. We'll shatter complicated COVID anxiety by helping each other be the best we can be to make our hometown a better place. Now, Gabi, we promised time at the end for questions. We'll take those now.
Yes, we did. And I do want to point out, Dwight, over here, that's Sandy Webster made an excellent comment. And I just think it's really important to address. It's something that we've been talking about. We talked about the fact that we added the adolescent beds to meet the needs of not even just our community, but the communities that surround us. Communities as far away, believe it or not, as Clearwater and further south. The comment that Sandy made that resonated with me was that the American Pediatric Association and others, for the first time ever, declared a state of emergency on children's mental health. She works in the school system and she sees this a lot. And I can tell you for certain that is something that we've seen too. It's an absolute epidemic. And what we've seen, COVID, and how it has affected the entire family dynamic and how that's filtered down into the kids that we are treating here at the hospital. It's just absolutely, it's tragic.
It's growing. It's tragic. Thanks, Andy. and Gavi is growing. The physical medical piece that's winding down, and sometime in January, we'll get the all clear that some things are, quote, back to normal, going to the movie theaters, football games and such, basketball games. But remember, the psychological piece will be amping up over the holidays, and it'll be climbing. The best research I have right now is it looks like for the next 12 to 18 months, the mental health tsunami. Remember, Gavi, early on, we talked about the mental health tsunami that it was building. It has not crested it. It has not peaked, but it'll be there by this time next year. And that's why we're seeing whole school districts saying we have teachers calling out that are not coming back, and class sizes have to, by governmental decree, have to be a certain small size. We don't have people to put in the classrooms. What's going to happen when things melt down and people feel anxious? They're going to call professionals, just like everybody that joined us today. And we're going to do this. We're going to keep giving you tools and resources and equipping you and resourcing you so that you can go help make a positive difference with others. You know the continuum of care, the hospital's there, but the first line is you. They're going to call you. And I hope that our time together gave you some tools and gave you some hope so that when they call you, you'll be energized to say, yeah, I can show you a way out of the darkness. Come with me.
And Dwight, it's not, I will tell you as the person that is responsible for this hospital in terms of our outreach and making sure that our services are reaching where they need to reach. It's not just the kids. You mentioned the word mental health tsunami, the tsunami. You have been 1000% accurate on that. You said that when this first started in March of 2020. You also said, I remember when we first started this COVID recovery series, which I sent a link to, by the way, on the chat box, as well as our Facebook and LinkedIn to stay connected, everybody. You also said that this would probably last for a good couple of years, and that was true too. I think in the beginning, a lot of us thought, I'll probably go back to my normal life in April or in May. And obviously that has not been the case. So I think adults are have been just as impacted, which is why we've really have all these different units for adults as well, whether it's your substance abuse, which you had just mentioned. We've seen a large increase as well. We provide services for folks that are co-occurring, that have mental health as well as substance, because that's become a much larger piece of the puzzle that we're seeing here in terms of the treatment that's needed in the community. So it's not just the kids. It could be the people that are on this call, that if you need help, take it. We have services not just for the kids. We have services for your dual diagnosis. We have services for folks that are having their first, God forbid it should be me or you, but if it were you and I, Dwight, we have a unit that is specific to somebody that would be, we might call it a professional, right? Somebody who would feel
absolutely
like you or me to go to a unit and have that sort of expected service.
Right. And remember, let me say this. I'm glad you brought it up, because the research that we have in our industry is about 1 in 5 are feeling so overwhelmed. It's not a fail to raise your hand and ask for help. It's a fail to keep drowning. And to be able to say, as I did with a family member a couple of weeks ago, here's a behavioral hospital. I trust them, and I want you to call them at least for the evaluation. And he did, and didn't need inpatient services, was a better fit for IOP, intensive outpatient. But it's a fail to keep drowning. It's not a fail to say, I need a life jacket. That's a sign. That's a sign of being aware enough to ask for help. We're all in this together. You'll see it at the top of the screen, and we're stronger together because of conversations just like this. And maybe in the not too distant future, we'll have this conversation together inside of a building, and we'll be able to say, we made it. We're stronger together. We're stronger when we can encourage each other. That's why we do what we do. And that's why we'll keep doing it, because we'll keep getting stronger by encouraging each other. Have a blessed holiday season, everyone.
Thank you, Dwight. Thank you so much for this and for the entire COVID recovery series. Thank you so much for mentioning our outpatient programming, which is available virtually as well. There's no excuse for somebody to not get help, because we will make sure it is available if you are willing to seek it and to have it. It is available to you. Just a follow-up, guys, I will send out an email. Again, that email will have the CEU certificate, the evaluation. Please make sure you complete that evaluation so I have it for my records. And the CEU broker will be updated within 60 days. And we look forward to bringing you a lot of awesome trainings and a lot of new events as well at the hospital, with our community partners, with you in 2022 in January. I'm not going to tell you what event we have next, but I will give you a hint. And I'm very excited that we have something that might be something specific to our first responders, which Dwight, you actually hit on as well. We're very excited to bring that to you, but I don't have it confirmed. So I will not explicitly announce that. However, I am excited about the events and things that we have planned for 2022. So please stay tuned, stay connected. Thank you all so much and have an amazing, fabulous, and blessed weekend. Thank you, everybody.